on the Colorado Task Force. Marlo, we already met. Alexandria, welcome. I am Ruth Dismeet Blakely. I'm one of the faculty for AHA, and I'm on the EAR committee. And I don't know, and I've had my hand in everything at AHA, probably. And but anyway, but have been working on, and I'm from New Mexico. I have a full-time practice, if you don't know, for 42 years, actually. We've provided PTOT and speech, specializing in using hippotherapy as a treatment tool since September 21st, 1982. So a very long time. Yes. And in New Mexico, you know, we're kind of the land of mañana. And so it's actually been really great here because we never had any problem with reimbursement. So Colorado, it just was a challenge. We just had to get it fixed, especially since y'all are neighbors. And I always figure that if all the neighbors don't have it right, that New Mexico will really mess it up at some point too. But anyway, so for a long time, we've been working on this. Adam Dario at Temple Grandin has been very instrumental. And we put a task force together, I don't know, what, well, 2 years ago, at least, of therapists in Colorado who were all very vested in getting the Medicaid exclusion overturned. And I think all of you know that through a lot of work and a lot of effort and a lot of testimony and just, you know, just hard work, the Colorado legislature passed I don't know what you would call it, a law, a policy change, a statute change. Anyway, it will remove the law. Okay. Removing the exclusion of hippotherapy from regular Medicaid, and it will be effective July 1st of 2024. And that's all wonderful, but there's been a lot of worry about what the wording was going to look like and how they were, you know, what they thought they were doing. And you just have to know that I consider that AHA has done its part to mess this up too. But there's been so much confusion historically about hippotherapy's role in PTOT and speech. And the Medicaid people in Colorado in particular have been very confused about it. And you all know, of course, that it's been an exclusion under Medicaid and it's been a covered service under you guys' waiver programs, which don't cover PTOT and speech, but did cover hippotherapy as long as it was provided by PTOT and speech, which is, there's just so many things wrong with that statement. I won't even go there. And it's been a big mess. So it's all getting sorted out. And the most exciting news more recently, I want to, if you don't know her already, I want to introduce Kathy Alm, who's the CEO of PATH International, who has joined us this evening. And Kathy and myself and Adam Dario and Caitlin Peters from Temple Grandin all met with two delightful Medicaid policy folks, the policy folks from the Colorado Medicaid, from the Colorado Medicaid office about what, 2-3 weeks ago?
Yeah, the policy office, yes.
Yeah, right. They actually came to Temple Grandin, which just that alone was a huge step forward because they actually came to us, so to speak. And I flew up to Denver and we were all there together. And these folks are very, very committed to this rollout July 1st and making sure that it is a smooth transition. And we're so relieved to hear what hippotherapy's real role is in your treatment services. And you will even see the wording of communications that are going to be going out to all Colorado therapists and posted on the website and so forth, will refer to equine movement as a treatment tool, in parentheses, hippotherapy, for physical, occupational, and speech language therapy services. And just that right there is a huge, should tell you that they finally get it. They finally get it. And they understand that you will be coding your regular CPT codes and that it will just be part and parcel of what you do as a PTOT or SLP. And that because you'll be working with traditional Medicaid funds, that what you're actually doing is providing skilled therapy services for individuals who have medical necessity for PTOT or speech. Okay. And we're gonna, in a few minutes, we're gonna talk a little bit about, because a lot of therapists are not already Medicaid providers, and we're gonna talk about that too in that process a little bit. There are a number of you Colorado therapists that have been providing services under the waiver, under, I don't know why the initials always, what are the initials, Autumn? HICPUF? HICPUF, yeah. And been providing these hippotherapy services, which aren't real services, and are going to be trying to segue from the waiver, where you don't have to be a Medicaid provider per se, to traditional Medicaid. And both the Medicaid people themselves and the Colorado therapists that have been on the task force and the American Hippotherapy Association office and PATH International, we are all committed to trying to make that process as painless as possible and be a resource, because not only are there individual therapists who maybe have not done anything with Medicaid simply because hippotherapy was an exclusion, who need to become Medicaid providers, but there's a number of PATH facilities that have been involved with the HICPUF service model that are going to be sort of transitioning and either providing traditional PTOT speech, incorporating hippotherapy under the straight Medicaid, or, newsflash, what we're trying to do with the current programming under the waivers is segue to therapeutic riding. And that process is well underway, where individuals will be able to get therapeutic / adaptive riding services. And we're trying to kind of broaden the scope of that a little bit. So it's not just mounted activities. It's really, we've been kind of massaging the terminology a little bit. And Kathy, you can probably speak to that better, so that they understand that individuals that maybe shouldn't be on a horse could still be involved with horses and ground activities under that waiver programming. And those services would be provided by certified therapeutic riding instructors, and it wouldn't be under the jurisdiction of therapists at all. So it would very clearly be treatment under straight Medicaid and these horsemanship services, adaptive horsemanship services under the waivers. Does that make sense? Okay. Do you want to add anything to that, Kathy?
Ruth, real quickly, Ruth or Kathy, do you know, are they planning on potentially putting that under the pot of money as a therapeutic recreation, or a different thing?
I don't think they totally know. I do think they are both sides, both the straight Medicaid and the waiver folks, are very committed to not having a big loss of programming for clients. And there are a number of clients that have been benefiting from, I always put them in quotes, the hippotherapy services that would be appropriate to segue to these adaptive horsemanship services. And so they're trying to figure out how to do that. My own personal observation, and I may not know what I'm talking about, but I feel like they created kind of a mess for themselves in the way that they set this up initially. And the segue, the paperwork flow is a little bit intimidating, because they're going to have to come up. They certainly can't use the famous S code, nor should they have ever used it. But they're going to have to figure out how their line item budgets work and all of that. But, right now we're just kind of waiting. There's a stakeholders meeting that's going to happen, right, Kathy?
Mm-hmm.
And they're trying to get some things in order, and then the waiver folks will have a group of people. There'll be a meeting to try to sort out some details. I do think they want it to be somewhat smooth, and they're running out of time. They need to get it going. But conceivably, that does mean also that, for example, Heather, you could be providing therapy service for somebody who had medical need, demonstrated medical necessity for your skilled therapy services one time a week, and hippotherapy might be a tool that you use. And that same person might also still might have waiver money available to them in their waiver budget, that they could also get some adaptive horsemanship services for lack of, because we're trying to keep it kind of broad in scope, a second time a week. Does that make sense? So
Yeah.
they're trying to make sure that this is all going to be very positive. And the best news for me, having been involved in this for several years now, is that you have a whole group of people, both in Medicaid and in the waiver, that are like on board, like they are all about it. And the confusion and the sort of brick walls that we hit have been knocked down, I would say, completely.
I would
Huge.
absolutely agree with you. I mean, it was huge meeting with the policy folks and their reaction and their willingness to not only to listen when we met, but they actually sent us the language they were
Yes.
thinking about using so we could give them feedback about that. So it's pretty exciting. And then to also have we gave feedback to the Medicaid waiver folks on what they were putting together, and they were very receptive to the feedback, and I think really happy with the that we gave that feedback, which is what's leading to the stakeholder kind of conversation. And yeah, it's all extremely positive.
Yeah, it's very exciting. And so, I mean, that's kind of the overview of where you're at. I mean, on July 1st, you will be able to build, you know, if you're a Medicaid provider, you will be able to go through the normal channels of providing services, PTOT and speech under Medicaid, and there's not going to, you know, there will not be an issue if they incorporate a horse for part or all or whatever that you're doing. It will just be the standard thing. My concern a while back was being worried about what the fee schedules were going to look like, because I think there was a point in time where I don't know, I just was worried that somehow the waiver might be paying better than your traditional Medicaid, but that has not the case. This is actually going to be a win-win for the therapists, because financially you're going to get better paid for your treatments under straight Medicaid, which you should, but it was all kind of convoluted there for a while. And but it will be important that therapists start now. I would say anybody that's interested should go ahead, if you don't already have your Medicaid provider status in the state of Colorado, that you need to go ahead and go through that process, because it can take, you know, 4 to 6 weeks. It might not, but like I know here in New Mexico, it takes about 4 to 6 weeks. And so you want to be, you know, ready to go. And there have been some questions, and I don't know, you know, Autumn, you did such a great job on this document. Why don't you, and have you gone through the process? Somebody just recently went through the process, Lauren.
So Heather McLaughlin, I think you're on this phone call. I think
Yes,
she's sort of responsible for really kind of putting together majority of the information that's in that sort of step-by-step. And then I sort of have just helped a little bit with, you know, some editing here and there, but yeah, so I think Heather is probably the person to speak to that. I think she's been, I feel like you've had, I mean, Heather, I don't know if you want to go ahead and speak to the document that you kind of put together for with the step-by-step.
Sure, I can go over that. Let me find it here. I thought I had it pulled up and I did not.
I can share. I have a copy if you want me to share it.
Yeah, that'd be great if you could share it.
Sure. And the other thing is that Adria will probably need to figure out a way to make this document accessible to everybody. That would be, I mean, just be so great. And Heather, I apologize. I did not realize you were the one that had put it together, but it's
That's
really,
fine.
really nice.
I'm glad I had put it together based on my experiences, looking at the website, and also from a little bit of communication that I'd had when I was trying to figure it out. It is certainly not flawless, but it certainly was. So I'm glad, Autumn, that you made some changes to it, because it needed a little bit of changing. But it pretty much is just to get people started in the process. And so it pretty much, and they actually have a lot on their website, and that's why I just sort of made reference to a lot of these, the things that they already have, because obviously they're gonna have much more clarity. But generally, so the sort of the confusing thing is for when you sign up with Medicaid to be a provider, anybody who is either billing Medicaid or has somebody else billing for them. If you work for somebody, if you contract with somebody who is billing Medicaid for your services, either the waiver or straight Medicaid, there's a couple different categories that are a little bit confusing. So if you are billing Medicaid, then you will have a Medicaid number. I've had some people ask, how do I know if you work for somebody and they have been billing Medicaid for your services? Just ask them for your Medicaid number, so you'll know it. And then it gets a little confusing. Basically, the options are you become, so Medicaid has a billing provider, what they refer to as a billing provider, and then rendering provider. Rendering provider basically is who is giving the service. And then billing is who is actively going through and entering the request for funding. They're actually doing the billing. And you can have it set up if you are an individual. Then if you set yourself up as an individual, then you provide the service and you bill for the service. That's the easiest one. If you just are self-employed and you just are yourself, then you sign up as an individual and you can bill and render services. If you are, like a lot of us, partially self-employed in providing therapy using the horse as a tool, then and you are also working for somebody else, then you have to basically create, if you want to keep working sort of for yourself, then you have to create an entity that is a billing provider, basically. So I, Heather, provide services. My business, Rocking Horse Occupational Therapy, is set up to do the billing portion of it. And so that's kind of the confusing thing. You can't be signed up as an individual and be part of a group, billing under somebody else. So that's the glitch that makes it a little tricky.
So Heather, I have a question then, but you could be, can you set yourself up as a business? So Rocking Horse OT, and say you're working half-time for Rocking Horse OT as a rendering provider. Could you not then, as an individual, also work half-time for somebody else?
Yes, and that's what I do. I'm employed by somebody part-time, and then I work for myself part-time. Right. So at this point, obviously it's not an issue, but as of July 1st, when I'm working for the preschool, then they will bill for me as a billing provider. As a rendering provider. I'm the rendering provider, they are the billing provider. As of July 1st, when I work at the barn, then I will still be providing the service. My business that I'm affiliated with will become the billing provider for my personal business, for my personal clients. Does that make sense?
Yeah, and just FYI, everybody, that's actually pretty standard. Like it's similar in New Mexico. The thing is when you guys are set up as independent contractors and work part-time for these various entities that, where you might be providing services that include hippotherapy, it's a little bit of a gray area if you're not set up as an independent business, because the IRS has become, I feel like a lot of this industry has kind of flown under the radar. But if you're set up as an independent contractor, but you're not set up as a business, then, and you come into or you go into Heather's facility and you're using Heather's horses and Heather's horse staff and Heather's equipment and so on, and so on and so forth, you're actually functioning as an employee. You're not bringing your own stuff to the barn per se. And you could, there's a very thin line there between employee and independent contractor. And I think a lot of people don't realize how they're, if they really were audited, they probably wouldn't qualify as independent contractors. So I will tell you that in a way, even if you just, your new business can be, it's just having that tax ID number from IRS and your state gross receipts tax number or whatever. There's a protection in that across the board, whether you're using hippotherapy or not. But anyway.
Right.
So.
And that is sort of what my understanding is, that what makes my business has a different Medicaid number than
Yes.
I do.
Yeah,
And so
it's the
that's
billing
why
number.
my business Medicaid number is billing, and my business and my personal Medicaid number is providing, basically.
Exactly. And if you suddenly closed up shop and you went and worked for the hospital, your rendering, your personal Medicaid number would follow you. And
Yes.
then their billing number would become the bill, their Medicaid number would become the billing number. So that stacking happens across the board.
Right.
And I don't know, one of the things you all have to have in order to get a Medicaid provider number is an NPI number. And I was surprised at our task force meeting that we had that a few therapists on our task force didn't seem to think they had NPI numbers. That's the National Provider Identification Number for really everybody in healthcare. I kind of thought everybody had to have one, but anyway, it's so easy to get one, literally. You just go to NPI registry and fill out their form, and they email it to you within probably 48 hours. And that number follows you forever, regardless of where you work. So, and then, so how long did it take you, Heather, to get your Medicaid number?
So it's a little hard for me. It was kind of a research, because I actually, back in 2010 is when I actually established my business. And at that point was billing and providing. And then my business lapsed for a while. When I was not working for a little bit, my business lapsed. So then when I sort of reapplied, it probably took 3 weeks, maybe. It was shorter than I thought. And part of that is because I had not followed the rules to the exact letter, which I didn't know I hadn't done. And so they sent back and said, you need to fix these things. And then I fixed it. And then within a week, it was approved. So
Well,
they do say 4 to 6 weeks on their website. So for a new business, that might be the case. But for my business just becoming sort of recertified, it took less than a month.
So Kathy, because we've talked about how we're going to support some of the PATH facilities that are going to be doing some segueing and have therapy services under the waiver right now that will be hopefully moved over to, and that will be, they'll have to get a Medicaid billing number. They will have to be a business registered with Colorado Medicaid, and that we can, anybody that's already working with a barn, it's a little tricky because their primary identification as a business is not necessarily as a healthcare entity. And so there's going to need to be a little bit of research done. There's several different things that can be done. And just for this group to know, this was really more focused on you as individuals tonight, but we actually are going to host a similar meeting or two for facilities that are interested in how they can bill Medicaid in that process. So I want you guys to know that. So
how can I get the information to share with my facility?
Right. So there should be, and I think we could probably help you some. there should be pretty straightforward information right on the Colorado Medicaid website on how to become a billing provider. As far, what I don't know, and this may be something we kind of have to learn as we go, we're going to need a test case, is that if, Hearts and Horses up there in Loveland is their primary business is the business of providing adaptive riding, and they have a therapy clinic within, but if on their Form 990 or their corporate tax return, their industry is not as an office of PTOT and speech. It would be, their next code would be, actually it'd be recreation is what it would be. And so there have been times when people tried to get either insurance numbers or Medicaid numbers or whatever, this is just across the country, and didn't have that affiliation as a healthcare facility or the Office of PTOT Speech and Audiologists, or the right industry code, and couldn't get even from point A to point B. So it might be that some of these facilities need to establish, there's one of two ways I can think of right off the top of my head. One is to literally establish a clinic within their facility. So
Right.
I'm going to use Hearts and Horses again as an example. They're this great, wonderful adaptive riding facility, and then the therapist, they'd almost need to set up a subsidiary business with its own tax ID number and its own industry code and so forth running. So they'd have a practice working within their bigger corporate structure. Or this one hasn't really been tested, but it should work. If their primary industry code, represents their horse activities, they could have a secondary industry code as a therapy practice, and that, and they just have to be able to show that in filling out the paperwork. So I think it's kind of a bookkeeping sort of thing more than anything.
And the second one honestly makes more sense to me.
Yeah, it does.
Because so many of our centers have diverse services.
Yeah.
They aren't only therapeutic riding anymore.
Right.
They are offering PTOT or speech. They're offering mental health services, right? So
Right.
the second one makes the most sense.
Having
to
a
me, if that
secondary
can
code.
work. Mhm.
Yeah. And technically, to my understanding, you could actually have a tertiary code too, a third code. And so, just making sure, but it does mean that you don't, you don't commingle everything. I mean, you've got to keep everything sort of straight. And again, it's more of an administrative thing, but, so I think we probably need to have a document that's just kind of a bullet point.
Hey, Ruth, I'm
Yes, Laura.
about to embark on that exact path because
Oh,
we provide equine assisted learning services, and eventually we'll go into back into adaptive riding at some point with
Okay.
a new facility. But so I've actually been trying to work on our insurance piece and a bunch of different facets and the NACS codes just to make sure that I'm doing it right before I apply for Medicaid. So that's sort of my project in the next 2 weeks, is to dial those things in, and I'm happy to be able to share that
Good.
process. But we will also have a mental health provider too. So we'll have PT, OT, mental health counseling, and then we'll have, adaptive riding services. And we hope to be able to use the waiver for some of our clients that have been asking for the waiver for a number of years for equine assisted learning or adaptive riding, but we haven't accepted that. So
cool. So one of the best things about Colorado, you guys have already demonstrated it through the task force, and we're just sort of expanding that, I think, tonight, is that, I mean, you guys need to, the networking really needs to happen, and everybody's, everybody's in the same shape in a way, and, going through that process. And so, Lauren, I really appreciate that, because then that will help Marlo in what to tell her facility and anybody else. And I think we've, AHA and the ear committee has definitely been in this for the long haul. So we're happy to support, I mean, you know, my God, our national office is in Colorado. So we are so all about supporting the Colorado therapists and facilitating and, you know, trying to connect people with people, whatever we can do to help, for sure. Isn't that right, Adria?
Yes. Sorry, I was on mute.
Good.
And
And-
Lauren, I just wanted to add, if you have any questions about adding mental health, clinical counseling, psychotherapy, don't hesitate to reach out to me. I'm over at DU, University of Denver. I'm also on the AHA board as a clinician myself, as a psychologist. So please don't hesitate to reach out if you have questions in that area.
Yeah, that's really important. And PATH and AHA are working so closely together on this. I mean, to try, because yeah, I mean, it's gonna benefit everybody. And y'all are ending up being kind of a wonderful precedent on a national level. Because we're, you know, we have been working for years now to reverse exclusions all over the country, and we've made a lot of impact. But I would say Colorado is probably the first one for it to go the pure legislative route, and that has been just a very different process. And at the end of the day, it might end up being the very best process, as long as, you know, we have kept the wording correct. That was the critical thing. For a little while there, we were pretty worried that y'all were going to just be billing hippotherapy services under Medicaid, and that was like not what we were trying to do. And this Devin and Matthew that write the policy for the office they are spot on. They even got to watch part of an OT session while they were there at Temple Grandin, and it was just perfect timing. So, and they were just like, wow. I mean, it was really cool. So it made it real. I think it made it very real to them. So
I just want to say thank you for all the collaboration too, because we've been in business for 10 years and this has been such a thorn in our side. And so to see PATH and AHA and the Colorado therapists come together and continue to come together with different facilities and all the stakeholders has been really awesome, and something that we sure were hoping for. So thank you.
Yeah, it's been exciting. For
Very
sure.
good.
Those of you that we haven't heard from, does anybody have any questions or comments or concerns that they would like to share?
So, I work at Hearts and Horses, and Lauren from Hearts and Horses, who couldn't be at the meeting tonight, had mentioned if I could ask, has there been discussion about facility fees and any of the shifting gears here? And if so, what has been the feedback?
So that has not been a discussion point as of yet. Let me ask you this, Rose, is Hearts and Horses are they providing services to clients on the waiver right now?
We have just been doing everything private pay. There hasn't been any like foothills and all, yeah, no CCBs.
Okay. So I can tell you just from having been in practice doing this full time in one of the poorest states in the country forever and ever, that there's a lot of tricks to the financial piece of this, and it's really about maximizing your therapy schedule, which is probably a discussion for another time. But just so you know, generally speaking, your PT and OT for 4 units will be paying between, depending on which code you use, would be paying between 126 to 137 per hour for PT and OT. And anybody that bills third-party payers learns really quickly that particularly hippotherapy fits under a lot of different codes, and the 97530 therapeutic activities code, which will pay the highest on a per 15-minute unit, $34.28, that $137.12 per hour is kind of what you're looking at. The idea of, and then speech, we get paid the same whether we do 30 minutes or an hour, and it's about $80 per 30-minute session, right, Autumn, roughly, depending on what code. I should have pulled that
CPT
up.
code you're going to use.
Yeah.
So, but I mean, all of that is, I did find it on the Medicaid website, and I think they passed some law too where they have to start publishing what the fee schedule is. So I was able to find like every single CPT code, and then you could kind of, drill down into like whatever you're billing for.
Right. So the trick with Medicaid is that the standard protocol is with Medicaid and Medicare, and because this is more of a federal law, is that you can't pass on the unreimbursed portion to the patient. So if you're getting paid, $137 to provide an hour of PT, for example, and you feel like it costs you $150, the difference there cannot be passed on to the patient. So we're going to have to tread softly on the concept of quote facility fees per se. And I in New Mexico, because 72% of our kids are on Medicaid, like I don't do facility fees at all. I just figured out how to leverage my schedule so that we look really good financially, and everybody on staff makes at or above the national average for therapists in their discipline. So I think one of the things AHA is looking at is to try to, I know we did away with the business course, but we're going to try to come up with, we're working on some modules to sort of help, and some roundtable discussions to kind of help therapists with the whole reimbursement side of this, because you can't really charge more just because you choose to use horses. And that's always been kind of the thing, because they're expensive. So that's kind of a around the block answer to your question. But you will have to be very, it can't be called a facility fee. There's going to have to be some other mechanism because you can't pass on directly to a Medicaid patient the difference.
Okay, so, and that's kind of what I understood this to be, with the whole concept that if most places have providers providing services through their own entity and essentially leasing out space or utilizing space at a separate entity, like for example, for me, I'm totally separate from Hearts and Horses, even though I use their space. Is there an allowance for Hearts and Horses to bill as just a standalone? So Medicaid, there's no, no matter, okay.
I wouldn't think so. I mean, I think it bears investigating a little bit, but my guess is that the answer will be no, because the idea of Medicaid is it's based a little bit on financial need. And so you typically you can't, and quite honestly, even with a lot of health insurance right now, there's what they allow and there's co-pays, but there's also what you end up having to contractually write off, and you can't pass that. That balance billing has been a big issue in the healthcare industry across all healthcare services. And there's been a lot of federal, legislation saying basically you can't do that. So you have to be a little careful. So, but I am also here to tell you that there are ways to make this work financially, but it does have a lot to do with leveraging your schedules. So.
And I would think that would also go back to what Heather presented in terms of whether you're an individual or you're a group. So Rose, since you are an individual basically renting horses and facility and blah, 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 you're an individual. So the only way that there would be something for Hearts and Horses, so to speak, is if you were an employee and there was a department. You're nodding, Ruth. I did okay. All right.
Yeah, no, absolutely. And I mean, I employ 7 full-time therapists at Skyline, but they are employees and they're not paid salary. They're paid on basically an encounter basis. So every treatment they do, they get a rate, a certain amount, but when I do payroll, I'm taking out taxes and so on and so forth. They're employees, and that amount that, like I can tell you that based on our volume that, that Skyline would be able to pay for its paid horse staff and I can, I could manage on you guys' Medicaid rates, but that's based on me doing, a pretty high amount of volume, but that's also 7 therapists and 6 full-time horse staff. So if they were independent contractors, I would have to pay them more per hour, or individuals renting from me, so to speak, like you're doing, Rose, I would have to pay, they would either be collecting all of the money and having to take part of their money out to pay my facility fee, or as independent contractors, I would be paying them a higher rate because theoretically they would be taking their taxes out, and that would make it a lot harder for me. I would not want a bunch of independent contractors. I like having employees. So
the other business end of it, I could see, because we go back and forth a little bit about this. But Hearts and Horses could charge you a nominal fee and then they write it off. They fundraise on the back end. So that could be something that you go to them with and say, you charge me $10 for each client, but that really the facility fee is X. So that's just something for their books. And that could be something that they choose to do as a, goodwill. They're the services they're offering. That's just an idea. So.
yeah.
Oh,
It's an
thank
idea
you.
that it's an idea that works, Lauren. My background is that I ran a therapeutic riding center for 15 years in Washington State, and in the early years, that's exactly what we did. We had a contract PT provider, and we fundraised. She paid a small facility fee, but we fundraised to offset the cost.
Right. Yeah.
And we do that now, like we run as a nonprofit. So we fundraise money to just as we operate as a clinic, but we know that it's expensive and we don't have enough volume like Ruth does currently, just the way that our situation is. So we operate our business where we bill insurance and we're doing super bills and different things, but then we fundraise for the cost, and we write grants through the state of Colorado and different health foundations to offset our equine care and facility costs and different things. So I do feel like there's a bunch of different ways to do it, even if you have low volume, but it does just require some creativity, but making sure that you're still running a business. And I've learned that from Ruth. So
right. Well, and the whole idea of that side by side, you can also, there's a number of facilities around the country that have like a for-profit therapy practice or whatever, and have a nonprofit side by side that fundraises to offset the cost of the horses. And, and as long as you keep your lines clean and your books clean and everything, you're only limited by the law and your own creativity. And Colorado as a horse community is very supportive of, I think, of all the efforts. So at any rate, other questions? We've got about 10 minutes left for comments or concerns, requests. I think what you can do, we've been, the task force ended up being about, I don't know, there's probably been 8 or 10 diehards on the task force, and I think they will continue to meet. I don't know what the best way to network you all is whether it's best through The office is, just out of curiosity, not to put anybody on the spot. Well, I guess I won't do that. I was gonna say, is everybody an AHA member? Because we can connect things through the office too, if you are. But what you can do, I guess, is you could put your emails in the chat. And if anything new and exciting happens that you all need to know about, we can share that with you.
Oh, or come on, Ruth, they could join AHA.
Well, yes, I'm not a very good marketing person. I'll be the first one to admit it. You know, you really need to join AHA. We are here for you guys. Yes.
Just saying.
Yes. And that $100 bill a year is well worth it, especially since we now have Science Direct back on board and we've got lots of different cool things happening. Cool things. So.
Ruth, I was just going to say that I will put the document that Heather created. Heather, can you email that to me?
Or
And
Autumn
I will
can.
put it on the resources page
Okay. Oh, that
of
would
the
be cool.
website.
Okay.
And then we can
that
let
would be
people know about it.
Yeah, that'd be cool. And you should stay tuned because like if you're, I know like, I don't know if Marto's still with, oh, there you are. So like we are going to have a meeting. We're actually going to have 2 more meetings that we know for sure. One to kind of support facilities and becoming building providers for Medicaid. And then another meeting that PATH is going to host for once this waiver, when the waiver protocol gets lined out so that we can help folks with that, because I think that's going to really open a door to facilities that do not currently provide therapy services, but do have really nice adaptive writing services would now be in a position to provide those services through the waiver following, you know, whatever process they come up with. So we're going to try to hold everybody's hands as we go forward through this whole thing.
And Ruth, when you say facilities, we are talking about PATH International facilities as well, correct?
Yes, yes,
That's
absolutely.
a joint. Yeah.
Yes,
Okay.
absolutely.
Good. Just double checking.
Well, like Hearts and Horses, like they're like a great
Exactly.
example because because they're providing treatment. You guys are not, you know, you're set up with kind of a unique situation. And so it may turn out where you know, the Medicaid thing isn't even of interest to you, or you may want to set up as, you know, Hearts and Horses may need to set up as a Medicaid billing provider and you guys will rework your agreements with them. Or there's a lot of different scenarios. Rose, you as an independent business might be your own billing provider and so I mean, there's just a lot of different ways to approach it. And so, we'll be trying to help everybody out. So.
Well, I very much appreciate everybody's interest in being here this evening and sharing. Heather and Autumn, thank you for the document that doesn't look like it was a small amount of work necessarily. So very much appreciate you putting that together.
Yes, and Lauren's going to keep us posted on her on her journey.
Yes, please, Lauren.
Yeah.
I'll keep you posted. I'm currently doing insurance. I need to get it might include insurance too, because that's one thing that I've realizing that we were with Markel for a number of years and they're amazing and they've been such a great provider for us, but just given that we're kind of moving to a different level of billing, I'm redoing the insurance first. And I've been wanting to do it for a while, but this is the push to do it. And so anyways, so that's kind of the first beast, and then but I'm in the process of that. So
cool.
Great.
Well, if you have any problems, feel free to reach out.
Yeah, you've been on my list a little bit, but I think
I figured.
I'm getting there. I wanted to have some answers first.
Yeah.
Hey, Lauren.
Yeah.
I ran into a conflict with Markel several years ago, and I can't remember exactly what it was, but I was no longer able to be covered by Markel.
Yeah.
As a OT, I think they wouldn't cover the general liability, I think was what the issue was.
So
yeah,
they do not cover. Yeah, they definitely don't provide professional malpractice coverage at all. So,
no, and we hold our own professional malpractice.
Right.
We're all 1099 contractors, but anyways, needs to be different. So we need to be on HPSO or different as a entity.
Brexy is another one to look
Yeah.
at.
That's the one that I'm gonna look at
Yeah.
I've had that.
too. So
I-
I feel like that is an important part of the discussion too, is that piece as well. So I can include that in that document as well.
Yeah, I think that'd be great. I think so, because the
Yeah,
insurance
very
stuff is
helpful.
to navigate. Yeah,
Mm.
yeah. So
Yeah,
very
that
cool.
was a difficult thing for me a few years ago. You know, because I carry pro liability just
Mhm.
for my speech therapy side, but you know, the facility I was at, we weren't sure exactly what I needed beyond that.
Well, and what you also just need to know is that because because ASHA, APTA, and AOTA are still on record, and you know, I mean, Hippotherapy is just one of your standard therapy tools, and so pro liability, HPSO, Brexy, none of those can deny you professional malpractice and liability and coverage. It's irrelevant whether you use a horse or go to a swimming pool or grocery store or bounce them on a therapy ball or play Candyland or whatever you're doing. Okay. But the general liability piece has been a little bit contentious lately, and it's because of that. Like, you're covered as a therapist, but this facility also does adaptive writing, and they do, you know, able-bodied writing lessons, and they do a bunch of other stuff. And so insurance companies are trying to mitigate their risk. And you have to keep working up the chain. If you get no for an answer, go to the next higher level. Don't, that broker, it isn't educated enough to know about what's going on. You have to kind of keep working up the chain. And anyway, I mean, that's a discussion for another time, and we'll talk about that. I'll make sure we talk about that when we have that meeting. But in the meantime, if anybody's in the process and has questions, it's pretty easy to get a hold of me. So
Yeah, that's been something that's been confusing to me for a while. Like, is the pro liability enough, or
yeah,
horses,
once-
do they need to have something else?
it has, one of the things that you do have working for you in Colorado is you do have the Equine Liability Act in place. And so there's nuances to all of this, but then there's nuances to, So anyway, won't be a discussion for tonight, but if you run into a problem before that meeting and you need to have some questions answered, you know, I can arrange a phone call or whatever. So.
Perfect, thank you.
I'm so glad that you guys all joined us tonight. This has just been like such a long ordeal, and it's just so exciting. I was pretty emotional when I left when I left Temple Grandin a few weeks ago, because it just was like such an exciting development. It's been a long time coming. So anyway, we have 2 minutes. Are there any other quick questions or comments? Do you have your hand up, Nina? I mean, your hand is up, isn't it? I'm not very good. I'm a terrible media. No, it's
I'm
not.
not sure my
That's
hand
mine.
is anywhere.
No, okay, no, that's my cursor. It's been a really long, it's been a long week already, and it's only Tuesday. So, never mind.
Well, Ruth, thank you so much for all of your work on this too. I mean, you've been instrumental in this process. Like we could not have done it without you. So
it's been interesting. It's been educational, but anyway, you're more than welcome. You know, like I said, it's also been a little bit for my own survival, because I can, you know, states like, well, what are they doing? We're working on another state right now, Idaho, and it's amazing how they want to know what other states are doing. And so I just feel like so we're holding Colorado up. Well, look what Colorado's doing. Look what Colorado's doing. We just all are in this together, and it's been good. And
well,
so,
accept the kudos, Ruth, because the work you have done is truly amazing. And I know
Thanks.
you haven't done it alone. I know there's people with you and behind you, but you deserve a whole lot of the credit.
well,
So
thank you.
You
Thank
do.
you. It's a labor of love. And also just a little part of me that just couldn't take no.
Well, we're glad you didn't.
I know. I love that part of you, Ruth. Most of the time.
I know. Every now and then.
Every now and then, yeah.
On that note, I hope everybody has a wonderful evening. I will see